CPC Exam Quiz 20 AAPC questions with answers. Test yourself. Question 1. A primary care physician administers DTP, live mumps and live measles vaccines at the same office visit. All three vaccines were administered from separate vials. The DTP was administered by intramuscular injection. The mumps and measles were administered by separate subcutaneous injections. How should these injections be reported? Option A, 96,372, 96,374, 96,375, 90,701, 90,704, 90,705. Option B, 90,471, 90,472 x 2, 90,701, 90,707. Option C, 90,471, 90,472 x 2, 90,701, 90,704, 90,705. Option D, 90,471, 90,472, 90,700, 90,704, 90,705. The correct answer is option C, 90,471, 90,472 x 2, 90,701, 90,704, 90,705. C. 90,471, 90,472 x 2, 90,701, 90,704, 90,705. Question 2. A primary care physician administered 100 mg of RSV immune globulin by intramuscular injection. How should these services be reported? Option A, 96,372, 90,378 x 2. Option B, 96,372, 90,378. Option C, 96,372 x 2, 90,378 x 2. Option D, 99,211 to 25, 90,378 x 2. The correct answer is option A, 96,372, 90,378 x 2. A, 96,372, 90,378 x 2. Question 3. A psychiatrist saw his patient at a residential care facility. The psychiatrist provided 50 minutes of face-to-face individual psychotherapy relating to the patient's schizophrenia. The purpose of the treatment was to attempt to help the patient modify his behavior to better manage his disease. How should the physician's services be reported? Option A, 90,826. Option B, 90,806. Option C, 90,818. Option D, 90,819. The correct answer is option C, 90,818. C, 90,818. Question 4. An ophthalmologist performed an intermediate medical examination and evaluation on an established patient. He determined that the patient needed contact lenses. The ophthalmologist prescribed and fitted one pair of contact lenses. The supply of the contact lenses was considered included in the fitting service. This patient does not have aphakia. How should these services, including the supply of the contact lens, be reported? Option A, 92,002, 92,314 to 51. Option B, 92,012, 92,310 to 51. Option C, 92,012, 92,314 to 51. Option D, 92,002, 92,310 to 51. The correct answer is option B, 92,012, 92,310 to 51. B, 92,012, 92,310 to 51. Question 5. Dr. Fredericks performed a cardiac catheterization on Mrs. Dillon last week to determine the extent of her coronary artery disease. She was subsequently admitted to the hospital for surgery. The surgeon performed a PTCA on the left anterior descending coronary artery and placed a stent in the left circumflex coronary artery. All of these services were performed during the same operative session. How should this surgical session be reported? Option A, 92,980, 92,982 to 51. Option B, 92,982, 92,984. Option C, 92,980, 92,984. Option D, 92,980. The correct answer is option C, 92,980, 92,984. C, 92,980, 92,984. Question 6. Mr. Tyler was admitted to the hospital and had a combined right and left heart catheterization. The operative session included injection procedures for a left ventriculography and aortography. Imaging supervision, interpretation, and generation of a report were also performed. A single physician provided all of these services. How should the physician's professional services be reported? Option A, 93,460 to 26, 93,567, 93,563. Option B, 93,453 to 26, 93,567. Option C, 93,451 to 26, 93,542 to 26, 93,567 to 51. Option D, 93,453 to 26, 93,567 to 51. The correct answer is option B, 93,453 to 26, 93,567. B, 93,453 to 26, 93,567. Question 7. Dr. May and Dr. Lin teamed up to perform a real-time image with two-dimensional M-mode recording for a transesophageal echocardiography study for Mr. Thompson, an 81-year-old male with a history of coronary artery disease. Dr. May placed the transesophageal probe and Dr. Lin acquired the images and produced a written interpretation. How should these physician services be reported? Option A, Dr. Lin, 93312-26. Option B, Dr. Lin, 93314-62. Option C, Dr. Lin, 93317-26. Option D, Dr. Lin, 93314-26. The correct answer is option D, Dr. Lin, 93314-26. Dr. May, 93313D, Dr. Lin, 93314-26, Dr. May, 93313. Question 8. Judy went to see her allergist for follow-up allergy testing. She was last seen by the same physician 1 month ago. Because Judy had recently recovered from the flu, the allergist took a brief interval history, 5 minutes, prior to administering the tests. She then administered 3 intradermal tests with allergenic extracts, delayed type reaction, and interpreted the test results. How should these services be reported? Option A, 95,028 x 3, 99,211 to 25. Option B, 95,024 x 3, 99,211 to 25. Option C, 95,028 x 3. Option D, 95,028, 99,211 to 25. The correct answer is option A, 95,028 x 3, 99,211 to 25. A, 95,028 x 3, 99,211 to 25. Question 9. A physical therapist placed a hot pack on Jane's right shoulder and left the hot pack in place for 15 minutes while he attended to other patients. When the therapist returned, he provided 15 minutes of ultrasound treatment on Jane's same shoulder. The therapist then provided 15 minutes of therapeutic exercise to the same shoulder. How should the physical therapist services be reported? Option A, 97,035 to 51, 97,110. Option B, 97,010, 97,035, 97,110. Option C, 97,010, 97,028, 97,110. Option D 97,010, 97,035 to 51, 97,110 to 51. The correct answer is option B, 97,010, 97,035, 97,110. B 97,010, 97,035, 97,110. Question 10. Mr. West is recovering at home from a postoperative wound infection. A home health nurse administered 4 cephalosporin, an antibiotic supplied by the patient. This 4 administration and home health visit lasted 4 hours. How should these services be reported? Option A 96,374, 99,601 to 51, 99,602. Option B 99,601, 99,243 to 25. Option C 99,601, 99,602 x 2. Option D 99,243, 96,374 to 51. The correct answer is option C, 99,601, 99,602 x 2. C 99,601, 99,602 x 2. Question 11. Which term identifies the imaginary line that separates the body into upper and lower halves? Option A, coronal. Option B, transverse. Option C, sagittal. Option D, dorsal. The correct answer is option B, transverse. B, transverse. Question 12. Molluscum contagiosum is a condition best described as A. Option A, a malignant skin lesion caused by a virus. Option B, a benign skin lesion. Option C, a benign skin lesion caused by a virus. Option D, a skin lesion. The correct answer is option C, a benign skin lesion caused by a virus. C, a benign skin lesion caused by a virus. Question 13. Which of the following is not a term that is typically used to describe a type of fracture? Option A, comminuted. Option B, linear. Option C, percutaneous. Option D, green stick. The correct answer is option C, percutaneous. C, percutaneous.